talk about glamorizing nursing profession. So if anybody's interested, just keep on watching, and we just kind of want to kind of dive into the things that we've been seeing when it comes to nurses and glamorizing the profession to be something that it really is not. Or if it
Mhm.
is for some people, no one is talking about what it took to get to that point. So it's okay with, having, loving, wanting to have a great lifestyle. But the unfortunate thing is that people are tending to basically project the lifestyle without talking about all those extra shifts they had to work, talking about what they had to go through at work to get there, talk about how much money they had to save in order to get there. It wasn't just one day they became a nurse and the next week they in Dubai. It is nothing like that for most of us. For most of us,
Mhm.
there's always exceptions to rules, but we're talking about the rule, not the exception. So that's kind of what we're going to talk about tonight.
Yeah, it's a lot of behind the scenes work that goes on that it's not sexy, so you don't hear people talking about it. So we wanted to kind of give some realistic expectations to people um, who may not quite understand what goes into that. I mean, you think about it, you see with celebrities all the time. You see their end result, their end product, whatever it is, a movie, an album, whatever it happens to be. But they likely went through hell before that movie release, album release, clothing line, whatever. It's the hustle behind it. A lot of times you see the end result, but you don't see what it took to get there. So we're gonna dive into some of that. So we can get the
Hey,
conversation
Randy.
started.
Thank you,
Randy in
Randy.
here, the
Yeah.
live king,
Yeah.
the
Hey,
live
Secret
king in
Taurus,
here.
how are you?
Hey,
Darling
Secret Taurus.
Flower, how are you? I have not been on here. You're right. I have been busy. School is starting back for my students. I've been on vacation. But thank you for joining us. We have been extremely busy just working, as I'm sure many of you all have as well. Thank you, Secret Taurus. Thank you, Randy. I appreciate you. Thank you, Post Page, for the likes. I appreciate you.
Hey, Randy.
I know what that means when he says that. So anyway, we just want to kind of elaborate on that because people up here, even those celebrities or even those artists you were talking about in terms of like music
Thank
artists,
you.
people like even Lizzo, they be behind the scenes. Even Drake was behind the scenes for like 10 years before they even, hit notoriety. They was not just there's Drake today and he appears spending all his money buy what he want to buy. That's the same thing that goes on in the nursing profession too. What's going on behind the scenes, what we had to do to work to get to where we want to get to. How many shifts that you had to work to buy that Birkin bag, and it isn't even style anymore. How many shifts that you had to work to take that how many shifts that you had to work, how many holidays that you had to work, how many of anything that you have to do in order to get to where you wanted to be when it comes to you taking that luxury trip, buying that luxury bag, living this lifestyle that unfortunately new grads tend to see, but they don't see what goes in behind it. So they're attracted to the dollar sign. And that same thing kind of happened when we looked into the whole travel nurse industry when we hit the peak of COVID, is where people start bypassing the patient. Even like nobody cared about the patient.
Hmm.
They just saw the 10K or 7K or whatever y'all was making per week. And then, now that done dried up. Now they working almost regular, almost back to regular travel pay, and that's not meeting the cut that it was making, when people was traveling to these different places around the world, which is great, not knocking it at all. But I really want to encourage people to really understand what goes in behind it, not just the fact that they're doing all these luxury things without the work that goes into it. And that's what people are talking about. So when you're taking these
Thank
travel
you.
trips, travel assignments, and you're having to work 4 and 5 shifts in a row. You're not getting the proper training that you're supposed to get. You are often the outcast of, in travel anyway, of the people you work with. Get the worst assignments.
Mm.
You get
Yes.
canceled from time to time. Same thing PRN, you get the worst assignments, but yet no one's talking about that. So, people, these new grads or new nurses or even nursing students currently are looking into the profession and think, okay, hey, I'm going to be able, when I finish nursing school, I'm going to wherever. Darling Flower says that's why I think that every nurse should start as a CNA so they know their hard work as a nurse. You know, Darling Flower, I can respect that statement. I didn't start off I didn't start off as a CNA and I understand it. So I don't think you necessarily have to start off as CNA, but I do think that, people do need to do their research about what nursing really is,
Mm-hmm.
and stop looking into nothing wrong with you want to start off as a CNA. I'm not knocking it at all. Start off as a CNA, whatever. But that also doesn't mean you're going to be a good nurse either. Just because you're a CNA doesn't mean you're going to lend itself to being a good nurse. I know some bad CNAs who makes them even worse nurses. So I guess what I'm saying is, however your standpoint is, whether you come in as a CNA, LPN, whatever it happens to be, do come into the profession for the right reasons. And I think that's kind of the point that you're getting at. The point is, I think you're saying come in for the right reasons, because they're not. They come in and see things being glamorized, and they say, okay, you know what? Oh, I see what this other TikToker is doing, and I want to do that too. I want to make that kind of money too. I want to do this. But what about what we actually come to nursing for, which is to take care of the patient? Now, for some people, it is a job. Okay, it's just a job, and they don't see it that way. But at the end of the day, we're talking about human lives, not rotating stock at Walmart. So that's just me. That's just me. You said I've seen new nurses come in and not knowing how to change a patient, not knowing how to transfer a patient. That's true too. But the thing is, all that can be learned. All that can be learned in terms of how to do all those things. I came in that same way. But that can be learned. Is Are you there for the right reasons? And if you're there for the right reasons, you can take the time to learn how to transfer, change, and do all those different things. So you're right about that. I've experienced
I've
that as well.
invested for okay. So Jason A says I've invested for a traveling nurse. She makes good money. What does that mean? Could you explain that a little bit more?
So you don't see what's on my side. I don't see what's on your side.
No.
Okay, okay.
But I do think, I mean, piggyback on what the other person said about being a CNA first, I don't personally think that that is necessary. Oh, Jason A says she has her own business. Oh, that's cool too. And yeah, I mean that's cool too. Maybe you're an investor in her business. That's great. But I'm pretty sure she has to work very hard. Entrepreneurship is not easy. I know a lot of times on the internet they make it seem like it is. Most businesses fail. Um, it's not easy. And if you're a sole proprietor, meaning um, you are the business, it's particularly difficult. It feels like you're never off from work. Personally, I don't like that business model, but not to say it can't be lucrative. But again, that's I always say is how do you measure success? Do you measure success with a dollar sign? Some people do, some people don't. But it just depends on what you feel works for you. She works all the time. See, she has to be single. That's why she is rethinking. It's hard. It's not easy. And a lot of times people see, someone did XYZ, a business or picked a particular career path, etc. And they say, oh, well, they earn XYZ dollars. Is that how you measure success? Because a lot of times people trading their souls for money. I mean, you sacrifice so much of your life. You can earn more money. You only get one life, and that's just the end of that. I mean, it's only so many hours a day. It's only so many hours you have on this earth, period. And it's how you decide you want to spend. Do you want to spend working um all these shifts so you can have 3 days of vacation? To me, that's just my opinion. To me, that's not worth it. I would rather just be off, even if I'm not on vacation, so to say, and enjoying my life, than to have to work for 3, 4, 5 extra shifts or whatever that might look like to be off for 3 days. And even though I might be in some glamorous hotel, whatever, it's 3 days. I'm tired the first two. By the
Yep.
third day,
Sleeping.
I'm just coming around. Yeah, the third day, I'm just waking up time to check out.
Mm-hmm.
So so just be mindful of that when you see it on these TikToks or Instagram videos. It's all now, maybe you got a sugar mama, sugar daddy, you got something like that going on. Maybe you got what they say, daddy's money, mommy's money. For the majority of people, that's not the case. The majority of people got to get out here and get at it. So if you got to get out here and get at it, you got to feel like, what's it to you? And that's going to be very individualized. But sometimes I get disturbed when I see people trying to portray a certain persona. Oh, I'm a nurse, I'm a physician. I may insert whatever it is they are, a business person, whatever it is, and look at this. And it's something that's shiny, whatever, whether it's a car, whether it's a vacation, whether it's a purse, whatever that looks like. But they never show the other side. I call it the unsexy side, where it's the hard work, the late nights, the early days, the stress, the anxiety, the pit they had in their stomach, um,
The
what they had
failure.
to go through, the failures. Oh my gosh, it's all about failure, because no one gets to success without failure, unless you hit the lottery. But for the most part, no, you don't.
And how many
So
times you play the lottery to get that? Most of us don't
exactly.
even win the first time, or you don't win big. So yeah.
So it's always a process, but people don't talk about that side of it because it's not sexy. It's not that attention grabbing clickbait. The clickbait is whatever it is that's shiny that they put in front of you to portray whatever persona it is. And I just think it's quite disturbing. I really do. And I think it gives the wrong impression to people that are trying to come into the profession or who may be curious about it. And it's just not a good look to me. So, and not to say you shouldn't enjoy the fruits of your labor. That's not what I'm saying. What I'm saying is, if you're going to tell the story, tell both sides of the
Tell the
story.
whole story.
That's what I'm saying. So that you understand where all this is coming from, and it just doesn't fall out the sky. So that you understand, okay, yes, maybe this person bought an expensive car, whatever it is, but you don't know the backstory that I've seen people have a fancy car and got an eviction notice on their door. So you don't really know the whole picture. So keep that in mind too when you see people flashing whatever it is that's shiny. 9.9 times out of 10, they're trying to sell you something along the way, even if it's a pipe dream. They're trying to sell you something. So I always say keep that in mind too. And just for all of the baby nurses, the future nurses, the people thinking about it, just understand that I'm just going to speak for this profession in particular. It happens all over the place, but just know a lot of hard work came before whatever that shiny object is. A lot of hard work. What's the ask? What's that net worth? Yeah, I agree too. Some people balance sheets don't look like anything, but they have their shiny things on the outside, So I was having a conversation with somebody earlier and they were like, oh, well, this person took a fabulous vacation. I said, that's nice, but in my opinion, that's not a flex. Show me your portfolio. That's a flex to me. But again, that's very subjective. But what I say all that to say is what you prioritize, but also understand that it's a lot of hard work that goes on behind the scenes.
All
Repent
right. So
every day, Jesus Christ loves you. Okay. Real talk.
Nurse K, I am Nurse K says someone who just graduated with me is starting NP school next year. How do you feel about that? We graduated a month ago. They bring no value to nursing profession if you only graduated a month ago and have already started NP school, because when you're starting NP school, even though when you start NP school, you're starting with the core classes. Is that correct? Right? Everybody starts with the core classes anyway. You don't have
Yeah.
nothing to bring to the core classes because you don't know anything. So, in terms of how I feel about
Thank
people going
you.
to NP school right out of school with no experience, it's a no, because the thing is, they will be a subpar nurse practitioner. They have nothing to build. They have nothing to build upon it. And frankly, that's somebody I don't want to see caring for me or my child. So I would never go to someone who knowingly has no experience as a nurse first. Now, hopefully, the person is working while they are hopefully y'all are currently or they are currently working while they're going to NP school. That will be even better. But if you're literally graduated a month ago, tell me, what do you know? What do you know?
Nothing.
What do you have that's going to help you build in NP school that is of value? You know absolutely nothing. That's the other thing that people don't understand. As new nurses, we don't know anything. We don't know anything. And so that's my personal opinion. People are going to continue what they want to do. The problem I really have is the schools who accept them. The schools, and
Yeah.
that tells you something. If schools are taking students as someone with literally 1 month experience, if you want to call it experience at 1 month, because you're still in orientation at 1 month. So you don't even have that really. Because orientation, you don't even have your own patients. Think about that. Typically, in education, in orientation, you do not have your own patients. So you don't even have 1 month experience.
Mm-hmm.
Your time don't even begin on the clock really in terms of how many service months you have, maybe so. But in terms of experience, your experience doesn't begin till you're on your own. So no, I would say that they're not someone who I would see as a reputable NP. And that tells me that school is also not reputable as well, because a school is going to want someone who comes in with a foundation of nursing and at least 1 to 2 years out of school. Um, I wouldn't even apply, to be honest with you, until he's had 1 year out of school, 1 to 2 years out of school, really two for a nurse practitioner. But it is what it is. But someone who's going to just sit there and apply and they have 1 month, you still in orientation, you don't know nothing. That's just my thoughts on it. Thank you, Pam. She says two beautiful, black, intelligent educators. Thank you.
Thank you.
But that's just
And
me.
I agree. And as an MP and someone who also teach other MPs in two different MP programs, it's a huge difference between the students who had a solid RN experience and those that went straight through. Usually, the ones that went straight through, they are grossly negligent because you don't know what you don't know. And I just tell them, I hope you can keep your license. Because understand, as advanced practice, you have a larger obligation to the patient. You have more responsibility, more liability. So you putting your the patient as well as your, because if the patient's at risk, so is your license. Them two go hand in hand. You putting all that at risk for what? For what? I mean, but what are you rushing for? It's not, it's I don't suggest it. When people ask me how long do I think they should have as a work as an RN before going for advanced practice, in my opinion, at least 5 years. 1 to 2 years, you're still getting your feet under you. You think you know, but you
But you
don't.
don't.
You really
Isaac.
don't. And it doesn't matter what your experience is. Whether it's ICU, whatever. I still think a solid 5 years to really be able to piece things together. And another thing about advanced practice people don't realize is, okay, you get accepted to the school. Now, if the schools, like Dr. P said, if they're accepting you with minimal experience, that tells you right there about the school. But okay, fine. So you decided, yeah. So you decided to go to the school that's going to push you through. Okay, fine. So you get there. You get through the program because half the program is watered down anyway. So, okay, you get through the program, you answer the test questions. Cool. Let's say you even pass boards. When you get out, you're not going to know what you're doing. And see, the thing with APR, what people don't realize, you don't get this long orientation like you do as an RN. So as RN, a new nurse orientation might be months sometimes, weeks and months. As an APRN, most places are not orienting you. They'll show you the EMR. You might get a day or two training on the EMR, but that's it. Nobody got time to be showing you where this is and trying to help you to formulate your diagnosis, your differentials, how to work up this, how things present. No, this is not phone a friend. You got to come to the table. It's not like you got this precept you can call on. Now, if you work in a state where you're not independent, the state I'm in is independent, but you work with a collaborating physician. And I've had worked in one state where I had a collaborating physician when I traveled, but that's a story for another day. But most of those collaborating physicians are not even on site a lot of times. And even still, they don't want you knocking on that door every time you see a patient. You're supposed to know what you're doing when you get there. As a new RN, they expect you that. They expect you not to know much. That's why you get such a long, drawn out orientation and people going over basic stuff all the time. Because it's that period of time where you're still a novice nurse. By the time you get to advanced practice, you should be just that advanced. You can't be advanced with no practice before. So keep that in mind. And when you are APR and you're expected to hit the ground running, now you might find some oddball place off in the sky that might give you an orientation, but the vast majority of places are going to expect you to hit the ground running. They'll show you that EMR, but that's it. It's not a whole bunch of you gonna keep calling me. People, of course you ask a question here and there, but you're gonna be deep and competent in every patient you gotta go run into somebody for. And I've seen it in places where I work. I'm like, you keep knocking on my door for, you don't know what you're doing. Well, what medication you think I should get for this? Okay, and I understand we all have those questions sometimes, but that shouldn't be every patient. Shouldn't be every patient, shouldn't be every other patient. If you get a complicated case, of course you should ask. Of course you should consult. But that should not be all the time. And I see that all the time with nurses who had little to no RN experience because they're not strong in pharmacology. You
Or
pass the test. Yes, exactly. And you're not strong in your patho. You're not strong in patho, and you're trying to diagnose a medical condition. I just let that sink in. Just let that sink in.
so Isaac says, doesn't it take 2.5 years to finish an NP program? So technically, wouldn't they have it? No, because the thing is, with the 2.5 years, they're expecting you to come in with some type of knowledge base, and you have none. So you actually come in with no knowledge, and then they're teaching you things on top of that. A lot of your NP programs or your graduate programs are self-taught anyway. So you may spend some time in classroom. You may, in terms of, some of it's asynchronous, some of it's not. You have to understand health policy, patho, pharmacology, all those things that you would have a better hand on if you had to spend some time in the field first. You cannot even critically think as a new nurse. You can't.
Exactly.
That you just can't. Those skills begin to emerge in nursing school. They don't emerge all of a sudden you go to NP school and you have it. I would never trust it. I would never trust a school or someone who went to the school who did not put patient care first in terms of making sure they were experts in their field. And it takes longer than 1 month to become an expert in your field as a nurse. Because when we come out of nursing school, we still don't know our pharmacology. Them 5 meds they taught you. They taught you digoxin. They taught you, like, there's certain
They
ones
do.
that we all know, right? They taught you about your antibiotics. They told you about your LOL, your labetalol. They told you about those kind of things. They talked about some of your mental health drugs. But you do not know, when, depending on what kind of practitioner you are, you have to know the whole gamut. And you don't even know
Mm-hmm.
how to assess. I have people who I sit there and they're like, okay, well, what sound I should be listening to? What sound you talking about? They don't even know how to palpate. They don't know how to percuss. Typically, registered nurses don't percuss, but they don't know how to do that. They don't even know to do all your listening before you do all your feeling. Why? Because when you go pushing on the abdomen area, you create sounds that may not be there that you created. They don't even know that. So no, it doesn't. You wouldn't have it because you never had it to begin with, and I think that's the point. You never had it to begin with. I would never want an NP who went right to school 1 month out, in case that she was talking about, talking to me about anything. Because honestly, what do you know? Absolutely nothing. You're a nobody. You're still a novice. You should still be in orientation yourself at that point in time, 1 month out of school. Nurse Lala says, you don't know what you don't know. She was talking about what you had said. So,
And
um,
then future nurse Keo said, my instructor told me there are so many people going straight to NP school after BSN. Shake my head crazy. It is crazy. It's actually quite sad. And again, I don't blame the students so much. I blame the schools because they're allowing this foolery because it's a business first. They're going to take your money. They're not concerned about your patient outcomes. They're just concerned that you pass boards.
right.
They don't care about your patient. Once you leave there, they don't care if you lose your license because you prescribe somebody the wrong medication. They don't care. They got your money. You pass boards. Bye. The rest is between you, the patient, and the attorney and the judge. They ain't gonna
And
do
then
that in the
when
board of
you
nursing.
become unlicensed, then what? When you're
Yeah.
unlicensed, because then once you become unlicensed, you can't go back and say, I'm going to work as a registered nurse now. You done messed the whole thing up. So Isaac then says, I'm just asking because the NP route is what I want to take eventually. Eventually is the key word right there, Isaac. And
Yeah.
I appreciate
Take
you
your
saying
time.
so. Go learn to be a nurse first. And then once you figure out what kind, because get this too, think about this. Half the time, we don't even know what kind of NP you want to be. Now, you may think you know right now, but until sometimes people come into nursing school saying, I want to be this kind of nurse. Okay. I want to be a whatever. They go through those nursing clinicals and realize this is nothing what I thought it was. It was glamorized on Grey's Anatomy. And I want to be an
And
ER nurse. And come to find out, that's not what I want to be. You see what I'm saying?
it
I think I
stinks.
actually like psych better than I do ER. And you go find out what you want to be. Take the time to get into nursing and learn what you really want to be. And then you fine tune that when you go to the advanced practice side. So that you say, you know what, I happen to love geriatrics, but I don't want to work in an LTC or a SNF all my life, or I don't want to work on a med surg floor all my life. I really want to cater to these kind of patients. Go learn that craft, master the craft of working with the geriatric population, if that's your thing. And then guess what? What is it called? It's called what is it called? What's the MP that works with geriatrics? It's something. It's a specialized one.
It's like adult
A,
gero. Yeah,
that one.
adult gero.
And then you can go do that. But the thing is, you bring the infamous, what you bring to the table. You bring nothing to the table when you literally have nothing to bring to the table. You are worthless as a nurse, let alone, have to say worthless, let alone as a nurse practitioner. Uh, Doc Sam, DMP says we need more NP fellowships or residencies.
Yes, we do. And yes, we do. The whole education, nursing education system just needs to be restructured, in my opinion. Eden says, agree. I graduated in May and passed NCLEX. Congratulations. A month ago, I can't differentiate lung sounds. It takes time. It takes time. Hoping to learn and gain experience once I start working as an RN. And you will. You hear enough crackles, enough rails, enough bronchi. It'll come to you. Enough wheezing, inspiratory versus expiratory wheezing. You'll get it. And I have NP students that can't differentiate, and I'm like, and you're supposed to be diagnosing and managing a patient.
Mm-hmm.
But again, I can't blame the student because the system is set and designed a certain way for a reason, and people fall into it because that's what's available. People do what's available. Another thing I tell people, and I'm really talking to myself to a point. If you're going to become an NP just because you don't like bedside, I encourage you to do this. Get out of the hospital. I learned that the hard way. So take a hard lesson from me. Had I known what I know now, I probably wouldn't even went to school for NP, but I didn't know what I know now. So I shared this knowledge with you all. If you're just tired of bedside hospital nursing, do something else instead of necessarily saying, "Oh, I'm going back to school for XYZ because I'm tired of this." If you're tired of that, just try something else. I'm telling you, doing outpatient is a totally different vibe. Had I known that, I would have done that. Go do something outpatient. Work for one of these insurance companies. Work for a clinic, um, a surgery center, etc., etc. The list goes on. If you're just tired of the politics and the hospital and the bedside, I call it the bedside bullshit. If you're just tired of that, try outpatient. Give that a year or so and see how that
Then
works out for you. Um, Eden says, I've always said ER nurse, but now I'm applying to places. ER sounds a little scary to me. I wasn't a huge fan of ER. I think the ER is one of those places you either love it or you hate it. I did a 15-week contract there. I ain't been back since. Um, Um, King Nani, hey, says hi. Eden says, I applied to float pool nurse residency in hopes of getting experience on different float and floor specialties. That's a great move. I love float pool. I love the agency. Personally, I like moving around. I like experiencing those different things. So you might get a good feel of what you might want to do. And King says politics will always be everywhere, just different flavors.
oh, good
Yeah,
point.
right. Yeah,
So
right.
Kitty says this is a whole mess plaguing MP education. So many variables. Very true. Doc Sam says I was one of the lucky few to get accepted to a primary care fellowship out of MP school. That's actually pretty good.
Cool.
Kitty says former DMP educator here left to go to med school. Um, because I see
Good move.
the profession going down. You know what? You ain't said nothing but the truth right
Like
there.
Mary
Nursing
J, you ain't kidding.
nursing is I ain't even gonna lie to you. The nursing profession has been watered down to the point where it does not hold the same value as it once did. I still can't believe people consider this to be the most trustworthy profession. 20 years. I mean, we should have lost that a long time ago. They said it's the fact that there is an NP program on every corner. You remember how I said they be popping up
Yeah.
like liquor stores?
Nice.
Yep, that's exactly what. Too many programs and the quality is decreasing. We said that. You ain't
Yeah.
lying. You
Watered
ain't
down.
lying. You ain't lying. Okay, hold
And
on.
and you know why it's like that? Because people support it. If people didn't support it, you show it with your wallet. If
Mm-hmm.
people stop going to those programs, but they're not, but I'm just saying, if people stop supporting those type of programs, they wouldn't be in existence. Um, Also, nurses don't do enough in politics and lobbying to try to change the structure of the system. That's a whole nother topic. But I say nurses ruined nursing because that's exactly what it is. Nurses
Yep.
did this. So nurses are going to have to be the ones that clean it up, but it's not going to just be one and two people. It's going to take the majority. But yeah, nurses ruined nursing. So we can thank each other for that. And they continue to do it because even these programs, a lot of times are set up by business people, but nurses work in it. So if they had a standard where, we're not going to do it this way, then you're not going to do it that way. Because we're the ones that have, because nursing programs have to be taught by nurses. It's not like you can just get any old body to teach it. So yeah, nurses have done this to nursing. And of course, that's not sexy. Nobody want to talk about that, but it's true.
Very
King says someone I respect here advertises BSN in 14 days, MSN in 12 weeks. That sounds like a Cracker Jack box type of thing to me. I don't know what that is, but I don't know. Maybe it exists, but that sounds like some bull to me. But
and guess what?
maybe it is.
That's glamorizing nursing too. Glamorizing nursing is also being able to try to get through something quickly without having any substance. We want the fast route. We want it
Microwave.
fast. That's another way of doing that. Bayou Kitty says, then the administrators penalize faculty who try to hold students accountable. Now you preaching. That is my number one issue. When you try to hold students accountable, they don't want to hear that. Why? Because they want the money. They want the money. It's just that simple. Mr. Gentleman says these jobs just want to be able to bill under your name as an NP. They don't care. I totally agree.
And another thing to realize too, when you're in the APRN role, and no, they don't teach this in most schools, you have to have a little bit of a business mind behind you because now you're starting to generate revenue. Whereas when you work as an RN, you're on the other side of the
Mm-hmm.
ledger. When you work as an APRN, you're on the asset side because you're able to generate revenue for said company, business, whatever you want to call it. And if you don't understand how that should impact your compensation, oftentimes you will be undercompensated. And also understand too, MPs are a dime a dozen. So you got the supply and demand issue as well. So a lot of people run and jump into this and don't really understand the inner workings. They just go, oh, I need another degree, I need another whatever, and don't really understand what comes with that. The accountability, the liability, the stress. It's stressful doing this. It, it's really just it's just a different kind of stress, but it's still very, very stressful. Um, and you work, depending on where you work just as hard. And of course, it depends on what you're doing. Some MPs do procedures. You got your CRNAs, and people glamorize that stuff. But I'm like, do you really understand what goes on behind the scenes? You pull back the curtain, it's a shit show there, like it is everywhere else. So I don't, so when I see that kind of stuff being, glamorized and I'm like, tell the whole story. You're not
So
telling the whole story.
Basket says we need more NP preceptors and residency that don't cost 4K. I don't know what that means. You may know what that means.
Oh yeah, that's money because okay, so what happens is, and it's an unpopular opinion. A lot of y'all might not like me, but it is what it is. So what happens oftentimes, and I get emails, I get phone calls, I get all kinds of solicitation. I keep telling people my phone number must be on a bathroom stall somewhere that say call Dr. Ray if you need a preceptor. So I get it all the time. Even people from out of state want to precept because schools don't pay the preceptors. And here's the thing: when you are precepting someone as an APRN, I just stated a moment ago how the APRNs generate income, right? So we are making money for said employer, whether it's your business, whatever it is, you are sending out invoices and you are billing, right? So you're bringing money into the business. When I have a student with me and I precept the students, they slow me down because they're asking me questions. I have to explain things to them, and that's cool. That's something I choose to do. But a lot of people don't take students because you slow down our productivity. Where I may have could have seen just throwing out a number, I may have could have seen 8 patients in 2 hours. Now I'm only seeing 5 or 6. Depending on where you work, the admin not trying to hear that, especially because the students are coming, they're not bringing any kind of income to the business. So a lot of times the schools don't pay the preceptor and they don't pay the institution that they're going to. So this is basically a free ride, but you're costing them money. Whereas when you're a nursing student on the floor, you're not really costing them money because the nurses aren't generating revenue. So you play a little bit of a different game here. So now you're costing productivity, which is costing them money. People not trying to hear that. And on top of that, I'm working and I'm not getting paid. So when you're RN and you teach clinical on the floor, whether it's med surg, P's, L&D, whatever it is, you're getting paid. Maybe it's one or two out there that's not getting. The vast majority of them get paid. For some reason, I don't know who thought this was a good idea. They don't pay MP preceptors. So you think I'm going to work for free? No, I'm not. Now, you might find some out of the goodness of their heart and bless them that will do that for free. But a lot of people won't. again, I blame the school. They need to bake that into the tuition to pay people, because not only is it taking my time, energy, and effort, but you also may be affecting my productivity. Now, even if I'm salary or I work, whether I'm salary or maybe I'm by the hour, it might not affect my personal paycheck. But admin still wants a certain productivity from their APRNs, because again, you're making money for the business. So now I got that pressure coming here, and I got the student coming here, and I'm supposed to do all this for free. Or if I'm fee for service, which is a large part of what I do now, where I get paid for every patient I see and I bill individually. Now you talk about messing with my money directly and slowing down my productivity. I don't want to hear that. So, and again, I do take students here and there, but I do charge a fee, and that's why. Now, again, I blame the schools because they need to bake that into the cost of tuition. I don't, and when I've been on in these board meetings and on these committees, and I say it's not a line item in your budget. No, I'm sorry, back it up. I say, why don't you pay the preceptors? They tell me it's not a line item in their budget. I know it's not a line item in your budget because you never do it. But then NP students get there and they trying to figure out why they can't find a preceptor. That's 90% of the problem. That's not, I would even argue 95, 99%. It's a very high percentage rate of the problem why it's so hard finding preceptors, because you're actually costing them money via productivity, but the schools don't want to pay. Why they don't bake that into the tuition, it's because people haven't made enough think about it. Because most of the people that's coming to NP school don't even, they have the blinders on and don't even realize that's an issue. Some people may, but a lot of people don't. And when I talk to people who's considering NP school, I say, look, first of all, if you don't have enough experience, just don't do it. You will end up in front of a judge somewhere. Don't believe me? Tell it to the judge when you get there. Secondly, when you vet the schools, in addition to some of the basic things Dr. P always talks about, making sure that it's accredited, making sure it's competitive, et cetera, make sure that they are going to place you with a preceptor. A lot of schools don't, and they will put that burden on you to find one. If they don't place you for preceptor, that's a red flag. I can't count how many NP students I have had beg me, can you precept me? I'm going to fail this class. I can't find another preceptor. And it happens all the time. And I'm just one person. I'm pretty sure plenty of other NPs get also solicitations too, because it happens all the time. But going into the program, you might not be aware of that. So if you're thinking about it, make sure you put that on your list. If they do not place you with a preceptor, find someone else. Or as TikTok say, pick somebody else. Because I'm telling you, it's going to be a burden. If you can't find somebody, it's stressful enough. You're going to add that layer of stress. Or like your person said, somebody's not charging $4K because they want to be paid. And they should be. If you go to an accountant, do you expect them to do your taxes for free? Good luck with that. If you go get your hair done, do you expect to pay your stylist, your barber? Probably. If they're not like your family or something like that, probably. When you go to Apple and you get your iPhone, your whatever, they ain't giving it out for free. So why wouldn't you expect to pay a professional who's teaching you the craft? Again, I blame the schools because they need to put that into the tuition. I don't think it's fair that students should have to come out of pocket afterwards. But again, that's the system for a lot of places. So keep that on your list if you're thinking about NP school.
Hey Morgan, how are you? She said you wouldn't need. She was talking about something else, not this. She said you wouldn't need to pay if you actually got experience like you're supposed to. She was referring to that 4K situation. Um, BioCutie says there. Then so many programs are set up nowadays where you can work and go to school easy. That is true too.
That's true too.
Some of
Yeah.
these work-friendly programs, but I'm also finding the work-friendly programs also water down their programs to make it easy for you to, again, it's all about money. These programs, and as an educator, I can say this, it's truly about the money. I don't care which program. That's why all these accelerated programs, these pop-up programs, these online programs, and yes, the infamous diploma mills. That's why they all pop up. That the one who said something, you said something about the BSN in so many days, or whatever you had said, or
In
something.
10 minutes.
It,
Yeah.
that's because of the fact that it's money driven. If I can get you to, why would I want to get a whole, now mind you, a BSN in so many months is one thing. I'm assuming you already have your ADN. in that program. If you already have your ADN and you can go get your BSN, just those few extra classes in so many months, okay, maybe I can see that because you already have the foundation as a nurse. But I do not see you going for a program from scratch and being done in that period of time. Um,
Many clinics have their applications open for FNP preceptorship. Just throwing this out there. Let me see. Many clinics have their application open for FNP preceptorship. What does that mean? In places like Mini Clinic, I mean, it's a place you can maybe go, but I call that like a recipe because what they do in those places,
a
like
lot of
if
rest.
you have, yes,
Mm-hmm.
like if you have this, then you do that. It's like it's mindless. You can almost tell a monkey to do it. So, and there might be some good side hustle money, but if you want to be what I call a real MP, that ain't it. Now, do you have some good MPs that work in those places? Sure, you do, but I don't think that's a good place for preceptorship because you're not going to get a whole lot of critical thinking there because they have things specified in a very specific way. If the patient comes in with this, you diagnose with this, then you give them this or this. But care really should be individualized. And when you talk about patients with multiple comorbidities, et cetera, everybody's not going to fit into that box.
Mm-hmm.
MPs do think for preceptors. Oh, I see. And you know, hey, if you desperate times call for desperate measures. But again, when you vet these programs, just make
We're
sure
not
you put that on your list of what to look out for.
Giorgio 2222 says bedside nurses are the best. They are. They're
They
great.
are.
I've just paid my dues and I'm done. I've already worked the trenches, so I'm done with that. The MPs I'm working with will be my preceptor at no cost. That's great.
That's great.
Morgan says exactly. ED nurses. Hold on, I'm trying to get caught up on this like a whole like thing of let me get caught up. Let me see. ED nurses are great NPs. Why do y'all think the nursing profession going down? I work in corporate and I'm just curious. Oh, I can tell you for many reasons. I'm a nurse educator, and Dr. Ray is a FNP and nurse educator as well. So it's going down because of the fact that, for one, we water it down by making the criteria even less and less and less to get in, number one. So we don't even vet the students that we bring in. Because there's a supply and demand issue, we want to bring in any and everybody who wants to be a nurse. You have these programs like, okay, you can't get in the 3.5 programs. Here, we have a 2.0 program for you, and you can get into that one. And the thing is, you take the same NCLEX at the end. If you're, if you're talking about an ADN or no matter if you're LPN or what, you still take the NCLEX. So you take the same NCLEX at the end. And then you have more people, they taking your money. I had someone brag about their requirements, right? Was a 70. So you had to have minimum of a 70 on your test or whatever to pass the class. A 70 is nothing. We have watered down the profession by making it easier to get in, easier to get out, and easier to pass. And then because of COVID situations we've had, they even some states have cut the requirements to say, okay, you know what, you ain't even got to have a license right this minute. Just go ahead and you can work on the floor as a tech. Then you have these people who don't even value the fact that you have these people who don't even value the fact that we're being nurses, that we should have proper education and training and experience to move to the next level. So when you move to the next level as an MP, as the previous question a person had, okay, so I just graduated last month. I'm starting the MP school this month. What? Why would they want to take you? So the education as a whole is about money, right? Healthcare is about money. Everything's about money, but they're making it obvious it's about money. We don't even care if you have an experience anymore. That's the reason why we now have these direct entry programs. Oh, you don't have a nursing degree? That's okay. You can have a degree in art, and we're going to make you a nurse tomorrow, and you're going to be a nurse practitioner tomorrow at that. With no, of course, you still go through the classes of being an RN, and yes, you do have clinical hours, but that does not trump you going and being a nurse on the floor for 4 or 5 years, or even 2 or 3 years. So the profession itself has just been watered down. We have no standards anymore. Part of that because we're tired as nurses. We're just tired, but it just comes down to we will do anything for $1. And that comes back down to what our topic was in terms of glamorizing nursing profession. I'm coming to nursing because I can make all this money, supposedly, and
This
go on
ain't
all
it.
these nice trips and buy all this nice luxury, this and that. I'm not saying I don't have any of those things, but I definitely don't leave with that. Why? Because I know how hard I had to work for that. I've been in school for 13 years. Do they talk about that part? I've been in school for
No,
13
they leave
years to
that
get a
out.
degree, right? I did all these things. I have put in 16 years on that floor, working nights, weekends, holidays, working 4 and 5 and 6 and 7 shifts in a row. leaving, coming back, missing all these holidays that I miss with my kids. All that don't people don't factor all that into all the marriages that break up, all the people who get divorced, all because of the fact that their career has taken them on a different path. So all these things is what make the nursing profession going down. Plus, we have a lot of dishonest people. We have racism in nursing. I can go on and on and on. Do you want to add something to that before I go on to the next comment?
I agree, and I just keep saying, if you want to tell a story, tell the whole
Tell the whole story.
story. So people are quick to show the results, but not so quick to show the labor. And it's a lot that goes into it. Everything from clawing your way through nursing school, um, to hold on, 20. Everything from clawing your way through nursing school to working the extra shifts. And it's a very stressful profession.
Mm-hmm.
So it's like you see the end result, but you don't see what's behind the curtain. I'm just here to try to peel back the curtain so that people can make an informed decision, and also really have a good understanding of what they're actually getting into. Because after you done broke your back for how many weeks, days, and months, and you take some glamorous vacation and you think that people might look on and think, oh, well, that's it, that's the flex. It's really not. Do you realize what you had to go through to get to that point? And if that's what you enjoy, that's what you enjoy. But I'm just saying, tell the whole story.
Right. Morgan says Gen Z would never. They want immediate gratification. Morgan, you right, but Gen X would never either. I'm a generation behind, but we didn't play that either. We had to work. Gen X's, Gen Z's, we had to work. Some of these millennials, there's some things that millennials do though that I actually do like. They ain't loyal to nobody. They'll quit a job in a minute and go on to the next. Mistreat me, they gone. We were issues back with our issues. We were loyal to our companies. We got a job at 16, stay till we 85, and then we retired. But no, you know what? Gen X, Gen Z, we don't put up with that kind of thing. We understand that hard work is going to lend itself to a delayed gratification. The big picture is what we want to see in the end. I'm gonna take my journey, my milestones, take my steps and get to where I need to get to. I spent 16 years on the floor. Then at the same time, I was transitioning into an education role. After that, I transitioned full time into an education role to the point where I only have to work 8 months out the year and still get paid for 12. I mean, for me, that's good for me, but I may not be good for somebody else. We are really trying to ultimately say there's nothing wrong with having nice things. There's nothing wrong with taking trips. There's nothing wrong with doing enjoy the fruits of your labor. That's my thing. Enjoy the fruit of your labor. Nothing wrong with that. The issue we have is when people start showing all this stuff and these baby nurses, new grads, nursing students say, that's what I want to do. I want to do. Okay, but what part of doing all that lended itself to taking care of the patients? And that's why I said we tend to attract people for the wrong reasons into the profession, knowing that that's not what the profession's really about. And that's another reason why is it Mermaid 17? Why the profession is going down, because we're here for the wrong reasons as well.
That too. Yep. Some people just
Nursing.
and I'm like, if you want to just do something for money, this ain't it. Like seriously, if that's what you want is money, that's cool. But you can make a lot more money doing stuff that's less stressful. There are other options. That's all I'm saying. And if you're just in it for the money and you gonna go through the hell you got to go through to become a nurse, I'm like, you could have made the same money doing something else. I'm just saying. I mean, if you're just doing it for money, this ain't it.
You got comments over there?
Yes. Well, now they're taking away the travel nursing rate since we couldn't stop breaking. Yes, and that was another conversation I had earlier. And see, that was a flex and key. Oh, I'm getting X amount per hour. But as a seasoned nurse and a former, I did travel nursing before it was a thing. It's more behind the scenes with that than what people are showing. And this was way before any of this. Sometimes your contracts get canceled. You making extra money, but a lot of times, depending on how far away from home you travel, you got to maintain two households. And if they give you a living stipend, you're not getting paid as much. That's another thing people don't understand. It's some behind the scenes things that's not the sexy part. That's not the part people talk about. And it's cool, and I did it when I did it, and it was a good experience, clap clap. But to me, it's just not the flex that people were saying it was. And I knew those travel rates weren't going to stay. You know how I know? Because I understand basic economics. I understand supply and demand. The only reason hospitals were paying that amount was because They had a high demand for nurses because of COVID, and nurses were quitting left and right because, first of all, COVID hit the healthcare system out the blue. You talk about I got to reuse this same mask, and people was putting them in an oven and trying to, people were
Right.
afraid taking COVID home to their families, watching people die. That's why they paid those rates. But once that died down, I said, just Father Time always wins. Just give it a little time. Those rates coming down, so now people going back to work. They're less afraid of COVID, etc., etc. And now the demand just isn't there. Yes, are they still working short day? They've been short. They ain't nothing new. Short staffing. I hear people complain about short staffing. I'm like, where was y'all early 2000s? Because I've been seeing um, ridiculous staffing, been in SICUs and BICUs with 4-to-1 ratios. Where y'all been at? So this ain't nothing new. This ain't it. I guess it's just because we have so much more connection because of social media. But a lot of stuff I'm saying is not new. They just calling it something different, but this ain't new. But now somehow it's being glamorized. I'm like, do you realize the hell people are going through? And I wouldn't care how much you paid. You couldn't get me to work on the daggone floors. I don't care how much it was paying. Look, no, I ain't doing that. Pick somebody else. So I don't know. I'm just saying, if you're gonna tell it, tell the whole story. And again, I know nurses that got all this fancy stuff, fancy cars, fancy purses, and I said, you got a $3,000 purse, but you ain't got $3,000 to put in it. So you don't always know people's whole story either. When it comes to social media, people won't show you what they want you to see. Turn off the camera and you realize nobody has a perfect life, and they're probably just as a mess as the next person.
Doc Sam said there's a lot of work getting done in the background that you may not know about regarding lobbying. Well, if that's the case, they need to bring it to the forefront because the lobbying has to happen at a grandiose level. For nursing to change, it cannot be the people in California, and I'm just using California because they're unionized. It can't be people in California doing it, and that works for them. But what are we doing
Yeah.
for nurses? We got over 4 million nurses in the United States. What are we doing for the nursing profession as a whole? We have a profession that's full of women, okay? And the women, and you know what, this is gonna be unpopular too. So if anybody watching this anyway, we're about to say, but like for instance, y'all tell me what that march did back in, what was it, May?
Uh-oh.
What did that march do back in May? So that's where we should have spent that time. It was a great front to see what 12,000, however many nurses come together to march. But now what? So when you say that there's a lot getting done in the background that you may not know about, the thing is we all need to know about it as nurses so we can join the lobbying efforts so that we can do what we need
Exactly.
to make sure that we all benefit from whatever lobbying is being doing for safe staffing ratios and for whatever else we fighting for. And the thing is, that's not happening. So I guess enlighten me. What's going on in the background that we don't know about that we should know about? And I think that's my point. We should know about it.
Yeah.
Who's advocating for me? And I don't. I guess my point is, who is advocating for me? And I don't know nothing about it. That's just kind of the point. I don't need nobody advocating for my behalf, and I don't know what my behalf is. They may be lobbying for something that don't benefit us as a whole. How do we know
And
that?
And the other thing too with lobbying takes a lot of money. We talking millions and millions. So you're trying to raise that kind of capital. People who are your interested parties and your stakeholders, in this case, i.e., would be nurses. It shouldn't be a secret because you want support. Lobbying is all about money, like everything else. Lobbying is not about going up there, shaking hands, and begging. No, people, the strong lobbyists, the insurance companies, um, uh, companies like BP, et cetera, they come with millions and billions. When you have money like that, you really the ones making the laws. When you come with money like that, Senator whoever might be signing off on it, but you made that law.
Mm-hmm.
Happens all the time. So if
Probably gonna
nurses
pay.
are truly, if they truly lobbying, they should be raising capital. I mean, lobbying to the point where they really trying to get something done, like how people really get things done, like how we talk about healthcare. I could think of other examples, but just for the sake of healthcare, how when Blue Cross want to get something done, how when United Healthcare want to get something done, United Healthcare owns so much stuff. That's a whole nother TikTok I could do. When United Healthcare want to get something done, they got different names that they go under. Lobbying groups, their names are on different bills. That's lobbying, not this. I won't go up here and whine and play the violin. No. No, we talking about you really getting it done. You raising millions and billions. That's how they getting it done.
Basket says I've been seeing on Facebook groups. I'm reading some old comments. I've been seeing a couple Facebook groups that they are charging thousands to precept. That was kind of to her point.
Yeah,
Doc Sam says join your state nursing association and look for their advocacy activities. Great point. However,
that's
us
a
in
good thing.
ours is not doing that. Ours will sit there and say they're doing advocacy activities, but however, it does not lend itself to actual change in the nursing profession. So people still will have a caveat behind. They will have a whole slogan, a whole catchphrase. We're advocating, we're lobbying, we're doing all these types of things, but they're really not. Okay, the money going into their pockets. So make
Yep.
sure that your state nursing associations are vetted even still. Keep in mind your nursing associations, your board of nursing, your HRs don't work for us. They work for everybody else. So find out who they're actually working for. BioKitty says, I would tell my MP students when they ask why I need to know this is so that you won't be held liable. Right. There are lies. There are lies. Another issue with MP education, lack of accountability. Oh my gosh. Lack of accountability and consistency among preceptors. That's true too.
Also true. And a lot of
Doc,
times they're not getting paid.
some states offer incentives to MPs and institutions to precept MPs. Some do. A lot of
Some
public
do.
universities aren't allowed to pay to get their students a preceptor. A lot of public universities aren't allowed to pay to get their. They probably not. They probably not. You're probably right. You probably
Well,
right.
and then and that will continue to be a barrier. And see the other thing too, especially with education, it's so much bureaucracy. But anyway, somebody made a rule how many years ago? That person probably dead, and they still following the same rule because nobody changed it. Go and click the button and change the rule because those rules were made. How this is 2022. A lot of that, what you saying, those rules were made probably in the 1990s or before. But they still following it because every time you want to change something in education, you got to have a meeting for the meeting for the meeting and the post meeting and the post conference, then another meeting to follow up on the post conference meeting before anything gets done. And
Then it
it
promotes
happens
the
all the
president.
time. Yes, I'm like, just click the button. But it's in education, it's all, but in business just moves. Education is like they just keep kicking the can. They keep kicking the can. They keep kicking the can, and they will do that until their bottom line is impacted. You impact their bottom line enough, you get things done. But
Mm-hmm.
just whining is not going to cut it. So, um, they could if that is truly a barrier for them, they can have their meeting and click the button and pay the preceptors. But until they feel like it's that bad, then they're not going to do it.
Doc Sam says at my university, you need a B or 84% to pass any class. They have a reputation of being tough. That's a good program. That's really a good program. We're not seeing that. That the problem is that is not a universal thing. There's plenty of programs where people have commented on some of my posts saying, well, we only have to have a 70 to pass. And it shows that you only have to have a 70 to pass. That is the problem. You appear flexing about a 70, not knowing that you was subpar, getting a subpar education. That's kind of my point. And that's why I always tell y'all there's levels to education. And I've met plenty of them on here on TikTok who has subpar education, but they're not even bright enough to realize they don't have good education. That's the problem. Those are the same ones who go into NP school thinking they know something because they made straight A's in a 70 baseline program and thinking they about something. Like, no, your program wasn't even rigorous enough. Talking about everybody graduated. I'm sure everybody did with a 70. I mean, that's kind of the nonsense I be seeing on here. Tina says standards have really changed. I became a nurse in 2006, and you can definitely see the difference. Tina, oh my
Yeah.
God. Tina preaching. She became a nurse in 2006. I became a nurse in 2004, and you have not told nothing but the absolute truth. The standards have changed. And I've been in education since 2006. So you're absolutely correct. The standards have changed. We let anybody in these programs now, and we want to make sure that they finish, and we're going to help them finish. And we're going to go ahead and pad their grades to help them finish. I'm not saying anything about in terms of not making sure students are successful by giving them resources and helping them learn, but I'm not going to spoon feed you either. Everybody is not meant to be a nurse. And one day we need to wake up and realize the same way people ain't meant to be a physician. If you vet them on the front end, you wouldn't have to worry about these issues as much on the back end. Money is what really attracts. Yep. No bedside. You said no bedside manners at all. Thoughts on hospitals bringing in foreign nurses for cheap labor? It kind of goes against nurse egg. It goes against our bottom line.
Yep.
Again, your corporations such as your HCAs, your CHSs, your Kaisers, all your corporations are going to do whatever they can do to help impact their bottom line and save their money at the cost of the nurses. So the same thing we do anything else here in America, we always outsource for whatever we need. And that's exactly what's going on with the nurses. So when we sit there and say, okay, you know what, how companies bid on things like, okay, we're going to use Coke products or Pepsi products. Well, whoever get them the best deal, that's what we're going with. It's not because somebody sitting there said, I like Coke over Pepsi. Nope. Because Coke give them a better deal, we going with them. Guess what? In 5 years, when that contract is up, and if Pepsi come up with a better deal, guess what we doing now? We going with Pepsi. We going whichever way the pendulum shifts. So that's what we do in every aspect of America. If we can't get what we want for what we want, if you say you're gonna come over here, the foreigners gonna come over here, and you're gonna work for $15 an hour because where they live, $10 an hour, and their money is what they making. They rich over here. So from the business standpoint, I understand it. I don't agree with it because that our value is much more than that. And when nurses come over here and do that, they bring our value down because then we can't sit there and say we worth more than $25 an hour or $30 an hour when they working for 15. Hopefully that makes sense. Does that make sense what I'm saying?
Mm-hmm.
You said a lot of nurses, this is Doc Sam, says a lot of nurses don't care about lobbying and advocacy. They don't. Let me
They
explain.
don't.
Well,
It's
I'm at this.
usually not even a thought.
They don't care about lobbying and advocacy. You know why? Let's Doc Sam, let's have a real conversation here. And some people are not gonna like this, but I'm gonna say what I have to say. I want you to think about who nursing comprise. And nursing comprise of people who there a lot of times we are the just the racial breakdown of nursing is Caucasian, okay? And then we have women. And they are cared for typically by their husbands and things like that. You won't see, are you buffering? Am I buffering on your side? Okay, you were buffering on my side. Um, they don't have
No,
to care about
I
lobbying.
got a text.
Okay. They don't have to care about lobbying and advocacy because why? They're being taken care of by their families. They go to work, come home. They don't have to care about it as much as the rest of us do because they're being taken care of. A lot of us don't have that luxury but that impacts nursing as a whole. We don't care about it because all we have to do is go in, do our 3 shifts, and we come back home. And then when they start cutting on the bottom line, like, okay, guess what? Now you got to work 4 shifts. It's mandatory overtime. And when it starts impacting their bottom line, oh, and by the way, you can't wear your hair that way. Oh, and by the
Oh
way,
yeah.
you're gonna have to take over Matrix. Okay, you have to take 8 patients this time, and this becomes this consistent thing. Now they mad, but we've been dealing with this forever. We've been doing this forever, so that's why they don't care about it because they don't have to care about it. They hadn't had to care about it. I'm currently a nursing student. Is it only at the bedside nursing? No, politics is throughout nursing no matter where you go. So I don't care what you do. You're gonna deal with the politics of nursing no matter what. I still recommend you do bedside nursing for about a year and then move on to something else if that's what you want to do. But no matter where you go, the politics or everything we talk about in nursing is nursing wide. But see what you like. You said it's not a secret. Find out what your state nurse association is doing. Ours ain't doing nothing. I already looked it up. Ours ain't doing nothing. So okay. I went to Tina says I went to Galen and it was tough for both programs, but LPN was harder for me than getting my RN. LPN is going to be harder because that's your first entry into nursing. So when people always say, "Well, my ADN was harder than my RN," of course it was because you already had the program. You see what I'm saying? So anytime you've already been introduced to nursing, whether it be you came in as an entry as an LPN, came in entry as a 2-year RN, and you go back for your 4-year, a lot of times it's going to be easier because you've already had the baseline of everything. As an LPN, you went through pharmacology, you went through a lot of your basic classes. You just added a few when you became a registered nurse, so you were building from there. Same thing when it came from going from a RN, experienced RN, to an NP. You are building. So anytime that you're building from a foundation. So LPN is going to be harder because that was your first experience to the profession of being a nurse. So that makes sense. Same thing's true with the RN, 2-year to 4-year RN. It all makes sense. Boy Kitty says, NPs also need to know you can't have an RN mindset. Wait. NPs also need to know you can't have a RN mindset to business in the NP cough medicine world. Oh, okay. Okay, I think I get that. Let me say it again. NPs also need to know you can't have a RN mindset to business in the NP cough mindset. Yeah, I get it. I get it. They're saying that the mindset of a registered nurse is not the mindset of a nurse practitioner. Because it goes back to what you just said in terms of when you are RN, you were talking about something different in terms of preceptor. But when you RN, you work for that hospital, that clinic, that physician, that whatever. You can't pay the salary, right? When you become a nurse practitioner, kind of how we talk about fee for service, you and I have been talking about that off and on. You have to have like, okay, what can I do to generate the most income for what I'm putting out there? We don't do that on the bedside because you can get your $25, $30 an hour, no matter if you precepting somebody or not. So it's all about, in terms of, so you're absolutely correct. You said the cough medicine world though. You said the cough medicine world.
And also, there are some ways, and see, a lot of times with nurses, what I find is a lot of nurses don't think outside the box when it comes to certain things. So, a lot of nurses think task oriented, put in an IV, do my assessment, pass these medications, something along those lines. Although most traditional nurse roles, RN/LPN, don't generate revenue, there are still things, if you look around, you can do to either make the company money or save them money. And I did a video on that, on how to argue, well, I don't want to use the word argue, how to make a case for getting a significant raise. I'm not talking about this little 2, 3%, 5%. I'm talking about a significant raise where we're talking maybe 15, 20, $30,000 raises. Whenever I've gotten what I consider to be a significant raise, even working as a bedside RN, is because I was able to save them money. Because you have to realize, I will die on this hill, healthcare is a business first. Most healthcare places are for profit. Even nonprofits, they still make profits. They have to circulate money. You're paying physicians, you're paying nurses, you have to pay the staff, you got overhead, administration. Everybody want to go home with a paycheck. Hardly any of us are doing this voluntarily. So let's talk about it. What is it that I can do for this company? If I can generate revenue, how can I save them money? I did a project many moons ago where I decreased nosocomial infections on a floor I was working on. And as you all may know, when patients get nosocomial infections, that's a big hit to them revenue wise. So I got a 12K raise for that. Because, well, not only I'm shortening the story, but I decreased nosocomial infections and I put in a process to allow that to continue. And now I don't know what they're doing now, but then it decreased nosocomial infections. I can't remember if it was 10 or 11%, but 10 or 11% on your bottom line, that's a lot of money. When we talking about millions of dollars, you're talking about a nice piece of change. So that 12, I think it was 12, or was it 15K? 12 or 15K they gave me was nothing in comparison to how much money they saved. So I wasn't just thinking about, oh, let me change my IV flow. Yeah, I got to do that too. But I was thinking, I want some more money. So you have to make yourself valuable in that way outside of just, let me pick up an extra shift, which that's cool too that you want to do. But when I call a significant raise, you have to impact their bottom line. And I will down the hill. That's the language they understand. All of this about safe staff and about they don't care nothing about that. If they cared about that, they'd have been fixed that. Clearly, they don't care about that. They invest in what they care about. They don't care that you tired. They don't care that you picked up these extra shifts. They just see you as a warm body. Now, maybe your charge nurse or your nurse manager might, but when I say they, I mean the upper administration, the people who you all have ever seen. Your nurse manager is just a pawn. I ain't talking about him or her. I ain't talking about the charge nurse. That's just a pawn. I'm talking about upper admin. The majority of them, they don't care. They don't care.
About the
You might
patient.
find one, but most of them don't care.
Yep. If they cared about the
They
patients, we wouldn't have this issue. They don't care about the patients either.
don't care about the patient. That's a customer. That's just a point of revenue. They don't care about them.
They care about their insurance. Because I tell you what, if you ain't got no insurance, they get you out so quick. They get you out very quick. If you have no insurance, they get you back to your baseline. And that baseline wasn't much to begin with. They get you back to your baseline. The blood pressure still triples over triples. But you know what? It's lower than it was before. You're going back to where you came from. Whether that be the street, the corner, the jail, the nursing home, you're going back. Because you're not bringing them any kind of revenue.
Yep.
They have a responsibility to get you back, get you stable. After they do that, they put you out. And I've seen that happen time and time again. I think it was a TikTok when somebody said a Foley in. Remember that? He was laying on the corner somewhere. It was somewhere I saw a TikTok probably about last year sometime. He was laying on the corner, laying out in
I
the
think that
street.
was in California. Yeah, because in California, they will. I know some of the hospitals will like put you in a van, just drop you off on the corner if you still sick. They're like,
What
oh well,
Foley in? A Foley.
they can take the
They
Foley
didn't
out.
take you a leg bag. That's what you usually do. A Foley. Like that's
Yeah.
disgusting to me. Like you don't even value human life to the point of changing them to a leg bag. You just say, you know what? Yeah. So I mean, that's the reason why I said, and that's another thing. That's another way of them of when you think about when you go to your orientation. Speaking of glamorizing nursing, think about when you go to these orientations. They sell you some pipe dreams, right? This is
They
the best
do.
facility to work at, and let me tell you why. Meet your CNO, meet your CEO, meet this person. They up here, they don't ever say not one bad thing about the institution when you go in orientation. Then the next week, you finish hospital orientation and hit the floor, you find out everything they said was a lie. It was all a
Yep.
lie.
You right.
Because they're selling you pipe dreams. So even when it comes to glamorizing nursing, it's not even fellow TikTokers doing it. Your administration is doing it. Your CEOs are doing it. Your hospital admins are doing it. They glamorize nursing to be this one thing. Johnson and Johnson have commercials that they put out. You know,
Johnson Johnson
the
stay
whole
killing
nurses
people.
the whole nurses week notion is glamorizing nurses. Oh, we thank you so much. When we heroes back in 2020,
Yeah.
then we was
Pizza
zeros in
and dry
2021.
pins.
That's what I'm saying. So, like, okay, glamorizing nursing ain't even just what we do. That's what everybody does to sucker us in. Now, mind you, I love what I do. But the thing is, I know what I'm doing. I know in terms of me getting my job as a nurse, what it entails. I've researched my jobs. I see what I'm going to get, what I got to put into it. I do all those things. So we have to do better about vetting these hospitals, these jobs. Or if you have to take a job that ain't that great, you know it's temporary. You're like, okay, you know what? I gotta do this right now because I gotta go ahead and take care of my kids. I gotta go ahead and pay this debt. But let me tell you something, I'm about to pay this one bill off. Shoot, once I pay that off or whatever I'm about to do, save my money for whatever, I'm gone. Or I'm gonna finish this job until I'm finished school. Once I finish school, I'm gone. People have that mindset is a little bit different. It's people who walk into these hospitals or whatever thinking something's going to change because nursing is the best profession, but yet they complain every single shift that they work. Them people right there, I'm kind of like, mm-mm. You got some comments over there? A preference. You said I'm a villain.
Yeah, so I got let's see. Nurse T777. Hi ladies. Hey, hey. The homeless man, yes, the man who was dropped off on the corner. That's unfortunate, but that's like it's a business. So they're like, okay, we done with you. Get out. And I guess for whatever reason they couldn't get him enrolled in Medicaid, so they didn't have a payer. Good old J&J. Johnson been killing people since I can remember. And they came with a vaccine. I said, ain't no way in hell you give me no vaccine. Y'all have made baby powder, lotion, sunscreen, giving people sun cancer. I ain't giving me no vaccine.
Mm-hmm.
Nursing 777. It's all about the money. That's what it is. Uh, and see, this is where it's a disconnect. And if you talk to some physicians, um, people that are in healthcare that aren't necessarily glamorizing and didn't get into it for the, and I'm going to use the money loosely. Yeah, you do get a paycheck, but like I said, if you're strictly looking for money, this is not it. You can definitely do something else, make more money, and have less stress. I'm just saying, if you just straight up like I just want the money, this this ain't it. Pick something else. But anyway, it's always a disconnect because we're trained to take care of the patients and you know critical think and have these task oriented things and physicians too, they're all about patient outcomes, but the facilities that you work for are that's not their concern. It's their concern, but it's probably not even on their top five. Their real concern is running it like a business and getting their bottom line a certain way. And I say this all the time, what's good for the patient is not always good for the facility and vice versa. But if you're trying to protect your license and do what's in the best interest of the patient, then that's just what you just gotta do what you gotta do. And in some cases you might lose a job. At least you keep your license and hopefully the patient alive to fight another day. But just keep that in mind. So all of this is going around in the background, but meanwhile you see somebody, they got the phone and they on a cruise. you know what hell they went through before they was able to disembark, and that's cool too. That's what you want to do. I'm just saying, tell the whole story. Because and a lot of these issues affect everyone. If you and on top of, if you remember the BIPOC community, of course, we had some additional challenges as well. Um, but a lot of these issues we're discussing tonight, this is an everybody thing,
Mm-hmm.
regardless. And um, to just show one side of the story, I feel like is a disservice to those who may be onlookers who may say, oh, that's something I might want to do one day, or maybe they're looking up to you in some kind of, because kids are on TikTok too, and they say, oh, one day I want to be a nurse. Oh, I'm gonna be rich and do this too. No, baby, that's not it. That's not it. So that's that was the whole point of this live, and hopefully we were able to shed some light um on things for some of you, and a lot of you, seasoned nurses probably already know a lot of, so probably shaking your head like, yeah, that's it. It's but it's the truth. Now, Nurse T777, now nurses and doctors have to keep a lawyer on speed dial. HC is a dumpster fire. You're right. And it's sad. It is really sad, but it's true. It's a very litigious world. And King says, have you guys watched Aftershock on Hulu? I
Nope.
haven't, but I'll put that on my list.
I gotta see that. Y'all need to also see, is a medical. It's a book. Medical. It begins with an A. I'm listening to it right now, and it's eye opening about just medicine and how people were treated in terms of being tested upon and treated. Minorities were treated, especially. Bayou Kitty says faculty glamorize as well and hurt the profession by admitting and passing students who shouldn't. You was
Yeah.
1,000% correct. I know people who do that.
Nurses have
Um,
ruined nursing.
sure, Aaron. Aaron, future nurse says, I have a question if you can answer it. Sure, what is it? Um, User 476 says, I understand what you're saying about the business side. I work as an MA, medical biller for NCNA. Yep. My opinion is a lot of nurses now shouldn't be. Yes. Yes, I agree with you. They shouldn't be nurses, should have never been nurses. Should have never finished nursing, should have never been admitted into nursing school. I actually know some students who I had who I'm like, who let you in this program?
How did you
Um,
get here?
Janice Flower says, love you guys. Thank you for bringing things to light and you're transparent. Thank you. Thank you
Thank
for
you.
joining us. Transparency. Thank you for joining us. We appreciate you. So yeah. So anyway, hopefully this has been this live for today. Follow us on Nursing Dynamics. That's the platform that Dr. Ray is actually on right now. Follow us on Nursing Dynamics if you haven't already. And also on TikTok and also on YouTube. If you go to Nursing Dynamics page, you go to the link tree, you'll find um all the links to what we just said. Or what I just said. Also, there's been people who've asked on my personal channel about where should I go to find X, Y, and Z in terms of books and NCLEX and on and on and on. And if you go over to Nursing Dynamics, which is the side that Dr. Ray is on, you go to the link tree, you will also see our Amazon icon that links you to our Amazon storefront. On the Amazon storefront, you go to Nursing Essentials and you will basically find books and things like that that we have vetted to be great resources for nursing school and beyond.
You're
Any final
welcome.
questions that you all have before we go? Because we're about to get ready and go.
Um, King says, appreciate you guys. We'll be checking out your YouTube, and we're working on some more content for our YouTube, something that's different from what you're going to see on TikTok. Ty says, love you both. Thank you guys for your time. Thank you for joining us. You're welcome. Nurse T777. These lives are informative and civil. No brawls here. Oh no, we ain't bring that kind of drama. Who lies you on? What's going? It must be
See,
something
they
going on
said
TikTok that
brawls.
yes, it must be something going on that I don't know about.
Okay, so you said, can I see what a placental site nodule is? I would have to look that up and explain it to you. So I'll probably send you if you don't mind asking me that question under my Q&A, Erin Future Nurse, I can tell you there because I have to look it up myself to see how to explain it to you. And then Tina says, for your information, if you think brown people aren't treated different, become a nurse and you'll see the truth. Oh my gosh,
Oh yeah,
yes.
yeah.
That is absolutely true, Tina. Thank you for even bringing that up because I have said people all the time like, well, I've never seen that. It's because you ain't looking. Or you know why? Not because you ain't looking. Sometimes because you're the one who caused the brown people to be treated different. That's the reason why you don't see it because you're doing it. So
Stepping on toes.
yeah, there's people who do stuff like that. But yeah, so yeah, I'm like, no, that people think we're not treated different. We are. We go through a lot as minorities in terms of in every aspect of life, from the business model to buying houses, buying cars, to buying clothes, to renting houses, buying houses, going to school, the grocery store. I mean, you name it. Do you
Hmm.
belong here? You go to your own job, right? And somebody will show up and say, "Do you belong here?" I saw a TikTok on it. What you mean? Do I belong here? I work here. So it's we treat it different no matter what area it is. It is very sad. Thank you for bringing light to that. All right, y'all. Well, we appreciate you coming and joining us on live. We'll be back in a couple of weeks to do another live on some topic. And if you happen to have topics that you want us to discuss, definitely go either
Yes.
Samant here or go to Nursing Dynamics and just leave us. It doesn't matter what video. Just find a video and say, hey, I was thinking, because y'all talk about this via live or do a video on this. We don't mind doing it. Whatever makes you happy. We don't mind talking about it. So just let us know. Until the next time.
Good night. See y'all.
Bye.
Bye.